Oké, dat ging niet helemaal goed.
Hey,
Oh, Ben, thank you, you're still here.
hey, yeah,
My, my,
sorry.
my, my phone overheated. So it's so hot, my phone overheated. So I am sitting in a different place right now, so please continue.
Okay, well, I'm sorry. So, Jasper, I don't know. I think the audience was still hearing me. Does that sound right?
Yeah, I'm gonna ask. Jongens, hebben jullie Dr. Bikman nog kunnen horen? Mijn
I
telefoon.
saw that you froze, but I think they were still making comments. So I just kind of finished that idea of carbohydrates.
Yes. All right, let's go. Yeah, I'm back.
Okay, so yeah,
Sorry about that.
my view, but I don't want Jasper. I wouldn't want someone to misunderstand me, because while I do say and I defend it vigorously, humans do not need carbohydrates in the diet. They are non-essential. Even the most strict dietitian would have to say that. They have to acknowledge that carbohydrates are not essential. I'm not declaring war on carbohydrates, though. I'm only saying they're not essential, so let's put them in their place. Let's not build our whole diet on the one macronutrient that we don't need. And then I would say it also happens to be the one macronutrient that spikes insulin the most, which to me is a concern. So let's shift that to focus on the macronutrients, proteins and fats, that both are essential to the human diet. We do actually need certain proteins and certain fats, and they're the two that have the least or no effect on insulin, which is a great way to live and be lean.
Right. So you talk about in the book about hyperinsulinemia, and that's basically the root of it all. You know, the root of the chronic disease.
Yep.
So what is causing though? What is the insulin doing to really cause the chronic disease? What are the processes that it's doing to create these chronic diseases?
Yeah. Yeah. So let me put that in the frame of insulin resistance. Insulin resistance, I like to say a new example or comparison analogy that I use now is that insulin resistance is a coin. And if I'm holding a coin, the coin has two sides. On one side of the coin is the insulin resistance, where insulin isn't working the same way that it used to at certain cells of the body. On the other side of the coin is the hyperinsulinemia, the fact that insulin levels are chronically elevated. Those two play together to drive diseases. So in the case of infertility in women, that is not a disease of the resistance to insulin per se, but rather the chronically elevated insulin. And in that woman's body, insulin is too high, and it's inhibiting the ovaries from creating estrogens. And now she doesn't make estrogens, and now she doesn't ovulate, and so no fertility. In stark contrast, the most common form of infertility in men is erectile dysfunction. That isn't a disease of the high insulin necessarily, although these two things always go together. High insulin and insulin resistance are always together. But in him, it's that his blood vessels have become insulin resistant. Insulin isn't working as well at his blood vessels. Insulin will normally tell a blood vessel to dilate, to increase blood flow, but in him, his blood vessels are insulin resistant. And so even though insulin's trying to induce this dilation or growth of a blood vessel, it doesn't work. And the blood vessels stay constricted. And now he has erectile dysfunction. So around the entire body, with Alzheimer's disease and liver problems and bone and muscle problems, it's kind of a balance. Some diseases are arising because of the insulin resistance itself, where the cell isn't responding very well to insulin. Other diseases are happening because the body is swimming in a sea of insulin, and that is hurting those cells that are still responsive to insulin, because some of the cells are still responsive and sensitive to insulin like they always were, but now there's just so much insulin that they're told to do too much, and it works against the body.
Yeah, so then you also get stuff like high blood pressure. That's also basically insulin resistance in the veins. Am I correct?
Yeah.
So the cells change the lock. Sugar is no longer welcome. It stays in the body. It glycates. Is that correct? Yeah, and that will make the body just chronically inflamed. Am I saying this right?
That's true. Yeah. So inflammation is a very unique kind of player in this movie that we're talking about with insulin resistance and health, where inflammation can be a result of chronically elevated glucose. When you are glycating amino acids in the blood, that starts to stimulate inflammation in the body. And in turn, inflammation is one of the key drivers of insulin resistance. So if the body's experiencing higher levels of inflammation, that is a key drive or key cause of insulin resistance.
Yeah, and you also talk about waist circumference. You know,
Yep.
that if you have a bigger waist, that's also a very big indicator that you're insulin resistant. So now the people are taking action, they're dropping their carbs. What is the role of ketones, which are basically not used when you're insulin resistant, only glucose? What's happening with the ketones once you drop the carbs and then you go, you know, you lower the inflammation and then the ketones come up and they do, they are used as energy.
Yep. Yes, you said it all very well. So ketones have an actual caloric value comparable to glucose. They have almost the exact same number of calories as glucose does. So it's a very viable energy source. The cells of the body are very hungrily using ketones, especially the brain. The moment ketones start going up in the blood, the brain starts using more ketones in place of glucose. So in the normal individual who's eating lots of carbs all the time and they have high insulin, the brain is using all glucose for energy and no ketones, because if there's lots of insulin, there's no ketones. But the moment ketones start to go up, the brain will start using less glucose and start using more ketones. So the brain perhaps prefers ketones as a fuel. And that might be why people with migraine headaches and epilepsy and Alzheimer's disease, they start to feel better and think better when their ketones are higher. It could be because you're fueling the brain a little better. Now, but then to back up, a ketone is essentially a piece of fat, a piece of burned fat. And by that, I mean, when insulin is low, the body really starts increasing its fat burning. So the body has two primary fuels that are fueling most of our energy demands: glucose and ketone and fat, glucose and fat. And when insulin is high, the body's burning glucose and very little fat burning. When insulin is low, it shifts. The body's burning very little glucose and very high amounts of fat. And when insulin is low for an extended period of time, maybe about 20 hours or so, there's so much fat burning that the body is burning more fat than it needs to burn. And that extra fat burning is what starts to turn into ketones. So
right.
we start moving that.
Yeah. So if I'm right, it's also an energy problem with the brain, because when you're insulin resistant, the brain has the glucose, but it can't utilize it. So it can't use it. And that's basically the foundation of diabetes. Is that correct? Is that like the foundation of it?
Yeah. Well, yes, very likely. Yes. The foundation of diabetes is that you can't basically, well, there's lots of ways to maybe describe a foundation, but one of the problems is they can't shift fuels anymore, and they're constantly stuck trying to burn glucose. But because the muscles have become insulin resistant, and muscle is the main consumer of glucose, and most of that, so muscle eats most of our glucose. 80% of the glucose we eat is going right into the muscle. And then the rest of that is mostly going into fat, about 15% into fat cells. But it needs insulin to open those glucose doors to the muscle cells. And so as the muscle's becoming insulin resistant, now insulin's coming to the cells, the muscle cells, and knocking on the door saying, hey, let the glucose in, but the muscle doesn't open the door. And so now the blood glucose levels climb. That's the foundation of type 2 diabetes. It's when the insulin resistance in the body has started to really affect the muscle. Now glucose levels just skyrocket.
Yeah, so and a lot of, I heard you talk about a lot of, some typical cancers are sensitive to glucose, like the breast, the prostate, and there's another one.
Yeah,
you have to help me.
Yes. So breast and prostate cancers are the two that I always emphasize because they're the most common. And both of those cancers are very often, if you analyze the tumor cells, they have an overexpression of insulin receptors, where they will have several times, 5 or 10 times the number of little doors for insulin to come and knock on. And so you have these two most common cancers. What's happening in the average person, or the person who's insulin resistant, is that they have a high amount of insulin in the blood. And so that is stimulating this excessive growth of these cancer cells, because cancer cells, insulin tells cells to grow. And the fact that the cancer cells have 5 to 10 times more insulin receptors means that they're 5 to 10 times more responsive to this insulin signal. So you have high insulin telling the cancer cells to grow rapidly, and you have high glucose, which is the fuel for cancer cells. Cancer cells use glucose for fuel. They don't use ketones, they don't use fatty acids, they use glucose. And so we have this perfect storm. High insulin fueling the telling or signaling the growth of the cancer cell, high glucose fueling the growth of the cancer cell, and now the cancer cells are just having a party, growing as rapidly as they want.
Wow. Is that typical for every cancer, or are these specific?
Yeah, I can't say. That's a wonderful question. There are more cancers than just breast and prostate, but undoubtedly there are cancers that don't have an overexpression of insulin receptors, but they still use glucose. Jasper, I know of no exception to this. Every tumor in the body uses glucose as its fuel. In fact, tumors love glucose so much, and they use glucose at, I think 20 times or 200 times more than any normal cell, that when we actually want to see where tumors are in the body, we will infuse what's called a radio-labeled glucose. It's basically a glucose molecule that has a very subtle radiation to it, not enough to hurt the body at all, but it's enough to detect with something called a PET scan. And it's kind of like an MRI almost. So we infuse the person with this radio-labeled glucose, and then we measure their body, and we can see where the glucose goes. And these cancer cells, like if someone has a thyroid tumor, it pulls it in so fast that you see this thyroid that's just like glowing through the screen, because cancer cells use glucose as fuel.
Wow, then it actually makes me a little mad, because why aren't we screaming this in hospitals, and why aren't we advocating this to a lot of to big groups of people? You know, I've been shot because of famous Instagram people in the Netherlands, because I tell these kind of things, and they're like, "That's crazy," you know, "That's crazy." But
no, in
why?
Fact, yeah, this is legitimate science. I am not saying a ketogenic diet should replace all chemotherapies and other cancer drugs. No one is saying that. But there is work of a professor at Boston University. He's a pioneer in this area. His name is Thomas Seyfried, Seyfried, I think. I'm kind of glancing up at his book. I have it here somewhere. Anyway, Thomas Seyfried at Boston University, he finds that there are certain inoperable brain tumors, like a glioblastoma. This is a tumor that you cannot remove because you would just damage the brain and the person would die. And putting people into ketogenic diets almost totally solves the problem. It's exceptional. So I'm not saying a ketogenic diet or a low carbohydrate diet should replace all other cancer therapies, not at all. But why not include it? Because there is evidence to suggest a benefit. And my thought is, if I get cancer, and I think about cancer, my mother died from breast cancer when we were all quite young. So it's something I think about a fair amount, and I'm worried about it for my own sake. And that's one of the reasons I generally adhere to a ketogenic diet, because I'm so afraid of cancer that now cancer is such a confusing, unknown origin, you know. So I don't see a curing cancer in the very near future. But even if the ketogenic diet can help me a little, then I'm gonna go all in. And so my advice to anyone is, yes, listen to your doctor, explore the best available therapies. But I would definitely, if I were talking to a loved one, I would say it's time to go ketogenic all the way.
Yeah, my mother actually had breast cancer last year, so she went on a ketogenic diet and lost a fair amount of weight. So I'm really happy about that, and I'm also
she's
scared.
Doing well now?
Her medication, that was actually my next question. Her medication, they took away two medication. And the medication is basically like insulin, right? Because they bump up the insulin higher when you're diabetic with the
Yeah.
medicine? And I saw that in your video, and I was shocked, and I couldn't sleep anymore. Like, what is this real life?
Oh,
What is this?
It's crazy. And Jasper, we know, we have data that when you treat, so this is, I don't mean to get off on too much of a tangent, but in type 2 diabetes, insulin is high. It's just that it's not working well. But the traditional view is, well, we have high insulin, but we also have high glucose. So let's just push the insulin up even higher by giving them injections, and now that'll lower the glucose. It does lower the glucose, but they're 2 times more likely to die from cancer when you do that. If you give a diabetic insulin, you double their risk of dying from cancer, and you triple their risk of dying from heart disease. So when we give a type 2 diabetic insulin, not type 1, but type 2, we make them fatter and we kill them faster. But it's a wonderful way to sell more insulin.
But why are they using it? What's the reason behind this medicine? What's the reason?
I honestly think it's because maybe 2 reasons. One, they don't understand how dangerous high insulin is. That might be a true ignorance on their part. And then cynically, number 2, it might just be that they want to make a lot of money. And I don't like to speak evil of drug companies in general, because I think it is a miracle of science that we have the drugs that we do. But in the case of insulin in type 2 diabetes, I think that is just a way to make a lot of money. That insulin should be for type 1 diabetes. In type 2, you just, I won't say you never need it, but it would be very, very rare.
Wow, it's basically shocking to hear this live. I've seen the videos, but to hear it again and to know that basically the insulin medication is making people with diabetes more sick and die faster. That's crazy. You just want to scream to people, stop eating sugar, and it's going to be better. Because can you completely heal diabetes? Can you completely get rid of it?
Yeah, so in type 2 diabetes, yes. Now, Jasper, even that is kind of clever, the way people will talk about it, because conventional thinking, like in a clinic, they will say type 2 diabetes is irreversible. It is incurable, because if you follow their advice, it is incurable. So imagine someone who comes to the clinic, they just get diagnosed with type 2 diabetes. And the physician or the nurse is saying, okay, here is your prescription for some medications. Rip it off and go take this to the pharmacy. If they try to treat their type 2 diabetes with medications, it will never go away. They will always need to take medications. It will never cure the problem. And so that's why they will say that, because if you follow their typical strategy, which is taking drugs, then it will never get better. Because diabetes, type 2 diabetes, is not a disease that is caused because you aren't taking drugs. It's a disease of your diet. And so if that conversation in the clinic goes, rather than, okay, here's your prescription for a drug, if they say, here's your prescription to change your diet, go meet with this dietitian, and the dietitian knows that this is a disease of too much glucose and too much insulin. And so let's just lower your glucose, let's lower your insulin, and now the disease starts to get better, because that is the truth. Type 2 diabetes is a dietary disease. And only when we change the diet do we actually improve the disease. But this sounds crazy to some people. Other people, they say that makes all the sense in the world. That is perfectly rational. I even like to end that thought by mentioning some diabetes drugs. So there are some of the popular diabetes drugs are called SGLT inhibitors. SGLT inhibitors, there are 2 different types. They will try to block the digestion of glucose from our diet. So we eat a bagel and you take an SGLT inhibitor and you just don't move that glucose into your blood, and it stays in your guts. And it gives you terrible diarrhea, unfortunately. But there's another type, which you take this drug, and then it basically starts pushing all of your glucose from your blood into your urine so that you urinate it out. And then you have a much, much higher amount of urine. But in that case, you're putting so much glucose in your urinary tract that they're much more likely to have infections, because there's always bacteria in the urinary tract, and bacteria, like cancer cells, use glucose as their fuel. So we basically are just giving the bacteria all the sugar they want to grow, and so they grow very rapidly. But what's so crazy about this, we're giving a person a drug to block their glucose digestion in their guts, or we're giving them a drug to push the glucose out into their urine. And then I'm just standing on the side whispering, why not just eat less glucose? Let's just eat less glucose. If that's what you're trying to push out of the body, then just put less in the body in the first place. And that's why a low carbohydrate diet can, in fact, cure type 2 diabetes. You can put someone with type 2 diabetes on a low carbohydrate diet. They can get off every single medication and have no clinical signs of the disease anymore.
Wow, this is amazing. This is really good for the people in Europe and Holland and Belgium, and also some people from the United States to hear. So Ben, I'm looking at the time. Can I ask one more question? Just a final question about the ketogenic diet. It's a very important debate we had with a lot of people from Instagram that are promoting this high carb, low fat diet and counting calories. That's really something, if you could elaborate on counting calories is not an efficient way to lose weight and get healthy, that would be amazing.
Yeah, well, happy to. Yes, so I think counting calories is a short-term way to lose weight, but it's not viable long-term. So, and there's a lot of reasons for this, but maybe I'll take a step back and present my big view. My view on obesity and fat cells and the growing and shrinking of the fat cells is that you can shrink fat cells through two different mechanisms. One is controlling the energy. In other words, low calorie. You just start robbing the body or depriving it of energy. Yes, it's going to start using more of its own energy, and then body weight will go down. Body fat will go down. Also, there's low insulin. And the low insulin strategy acknowledges that insulin totally controls the growing and the shrinking of a fat cell. That is 100% truth. There's no getting around that fact. You literally, as we grow fat cells in my own lab right across the hallway, you cannot make a fat cell grow unless insulin is high. In contrast, you cannot make a fat cell shrink unless insulin is low. It is impossible. Now, I'm not saying energy doesn't matter. I'm not saying calorie number doesn't matter, but there's something really clever that the body can do when insulin changes. When insulin goes down, metabolic rate goes up and ketone production goes up. And I'll mention that point in a moment. But when people are trying to go into perfect thermodynamic balance with calories in, calories out, you can never know exactly how much calorie you're putting in. You can never, ever know exactly how much calorie is going out. It's impossible. That's part of the problem with the calorie in, calorie out. You cannot know the truth, the true fidelity or accuracy of trying to count calories. But when insulin is low, we are burning about 300 calories more per day than when insulin is high. That's a lot of excess calorie burning. And if you're making ketones, remember, a ketone is a piece of fat. And when you have higher ketones, you are breathing them out and you are urinating them out. That is actual caloric energy that we didn't have to store, that we didn't have to work hard and work out to burn. We just wasted it from the body. So we have this kind of third way of accounting for calories that no one ever actually accounts for. And so my view on obesity is, yes, calories matter, but if we overlook what those calories do to insulin, then we're missing what I consider is the most important piece of the puzzle. Because if insulin is high, metabolic rate will slow down and the body wants to store energy more. If insulin is if insulin's low, then metabolic rate goes up and fat cells are breaking down fat and the body's using energy and metabolic rate, of course, is high. Now, having said all of this, one last comment. My frustration with the low-calorie approach is that it is based on hunger. And hunger always wins. This is why I say there's a short-term benefit, but hunger always wins, which is why if you're calorie counting, you almost always will lose and you'll go right off it and gain all your weight back. But if you start your weight loss journey with a low insulin approach that isn't based on eating less, The low insulin approach just says control your carbohydrates, focus more on fruits and vegetables, very little grains, very, very little sugar, and then focus more on protein and fat. And you can eat when you're hungry, and when you're not hungry, don't eat. That's really the key. So you don't have to be hungry. And that's the low insulin approach. So my idea, your journey is start with the low insulin approach. Control carbohydrates, prioritize protein, don't fear fat. And then you will lose weight. And then you'll get to a plateau, usually. And if you get to where you stopped losing weight, but you want to lose more, now focus on a lower energy approach. Now maybe start fasting more often. Before you were fasting just because you weren't hungry. Now we say fast because you're planning it. You have a structured fast, and now you're lowering your energy coming in. And now the low insulin and the low energy means you'll go from that first weight loss plateau to the next weight loss plateau. And now you've done it best. So we insulin advocates, me and you, we're not saying calories don't matter. We're not that foolish and we're not that ignorant. We're just saying hormones also matter, and maybe they matter more in a long-term view. And maybe one last thought, Jasper, the more someone goes on a low-fat diet, the more they're eating foods that they actually don't need, because we don't need carbohydrates in our diet. We need fat and we need protein. Literally, those are necessary for human survival. That's what we should be focusing on.
Wow, Benjamin, it's like a mic drop right now. You said it all. Right. And it's also, to end with that, a little bit of the satiety hormones, the ketones make sure we are not as hungry as when insulin is high. So am I correct? Right, that's correct, right?
Yes.
Yeah, so we should focus on that. Wow, it's mind-boggling, and I'm a little bit scared, because of the doctors basically not helping us in the right direction. They should basically say no medicine. Let's first try a low carbohydrate or ketogenic diet, and then look if maybe medicine is justifiable. But that's down the road. So
and Jasper, and this is my compliment to you. We need more people like you, because if the person can't get this in the clinic. And you and I aren't speaking evil of all doctors. We aren't, because you only know what you've been taught. And this just isn't something that is taught in medical schools. And so there are those of us that have kind of looked through the data. I mean, that's my job as a scientist, literally, and seen, wait a minute, we were a little wrong on some of these things, and there's another view that might be better and more accurate. If we can't convey that to a patient in a clinic, all the more reason to convey that on something like social media directly to the person, with the hopes that this person can make the changes because of their own studies, their own research, and they don't have to wait for a clinical visit to be told what to do.
Yeah, that's amazing. And I will keep going and tell the message in the Netherlands, Europe, Belgium, all the people that are willing to listen to me. And, I will tell them, buy the book, read the book. It's life-changing. It changed my life. And, also my mother's life, who had breast cancer. She's now on a low carbohydrate diet, and she's doing great. So it's a life-saving book. So Ben, you made my day. I was a bit nervous, but I want to thank you. I want to thank you so much for this conversation. I'm really happy how it all went, and I just want to thank you. Thank you so much.
Oh, my pleasure. My pleasure. Let's keep in touch. Happy to be a resource, and truly grateful to be kind of on the front lines with you. We're part of the same army, fighting the same battle, to just give knowledge to people, and then let them, with all of the knowledge, hiding nothing, let them make their own decision.
Great. Thank you, Ben. I want to wish you a great day, and I will talk to you maybe sometime later. Thank you.
Yep. Thanks, Jasper.
Bye, everyone. Bye-bye.